Now to the coronavirus pandemic. The pace of U.S. vaccinations is slowing. There are questions about whether the country will reach President Biden's July 4th goal of administering at least one dose to 70% of adults. So far, that number stands at 63%. And just over 41% of the population is fully vaccinated. There are growing concerns of another possible outbreak in the southern U.S. Mireya Villarreal is in Alabama, where vaccination rates are low and COVID cases have already spiked.
Tonight, the Biden administration is pushing to get 70% of adults vaccinated by July 4th.
This virus is an opportunist, and it will go to places where people are not vaccinated.
The vaccination pace is slowing. Among the 10 states with the lowest vaccination rates, Mississippi, Louisiana, and Alabama have the lowest percentage of adults who have received at least one dose, a stark contrast to the high vaccination rates in Vermont, Hawaii, and Massachusetts. Is there a concern that you could see another surge in Alabama?
We still have people that have not been vaccinated at all. So we really just had a test over Memorial Day, quite frankly, and I think that we will have to look over the next 14 days.
Even with the threat of another surge, some are still resistant to getting the shot. Have you gotten your vaccine yet?
No.
What's the wait? What's the holdup?
I'm just giving it some time. I'm not in a vulnerable group.
This is one of the last mass vaccination sites left in the Birmingham area. Once overflowing with cars, just over a dozen people drove through in the 2 hours we were there. Any reason why you waited so long?
I think it was just kind of figuring it out, see how everybody was doing with it.
To boost vaccination rates here, incentives are being offered Southern style. At the Talladega Superspeedway, a special promotion would let you drive your car around the track after you get a shot. Meanwhile, further north, the vaccine is making millionaires, like this Amazon delivery driver, the second winner of Ohio's Vax-A-Million lottery.
And I pretty much almost lost it inside the van.
Statewide, the UAB health system gave out more than 210,000 vaccine doses, but they call mass vaccination sites like this one the sledgehammer approach that just isn't working anymore. So when they shut it down officially on July 2nd, they will replace it with small pop-up sites that you'll find in trusted community centers and locations like churches and schools. Elaine?
Mireya Villarreal, thank you. Dr. Tyson Bell joins me now. He's a critical care and infectious disease physician and the medical ICU director at the University of Virginia. Doctor, welcome. President Biden has deemed June the National Month of Action to boost vaccinations. The director of the CDC, Dr. Lisa Wolinski, told CBS News this month is about, quote, meeting people where they are and understanding what they need. What does that look like exactly?
Well, I think just like you highlighted in the story, it means a switch from centralized distribution of the vaccine to really getting into communities and getting face-to-face with people that are still on the fence. Getting vaccinated can be an intensely personal decision for some people, and those who have chosen not to at this point, they all have their reasons. But we also all have our individual levers that influence how we make healthcare decisions. And so it's crucially important that we get into communities, speak with people, find out why they're hesitant still to get vaccinated, and find out what those levers are for them, whether it's financial incentives, providing childcare, or making maybe easier access. But this phase of getting into the communities and really getting face-to-face with people is crucially important right now.
Well, Dr. Wolinski says she expects the U.S. will reach President Biden's goal of at least partially vaccinating 70% of adults by the 4th of July. But the pace of vaccinations is slowing, and experts warn this next vaccination phase will be more difficult. Why is that?
Doing things on mass scale is generally easier, and you can vaccinate people much quicker. It is slower when you go into individual communities and try to do more widespread distribution. So what's more convenient for people is less convenient for scale. And that's what we're seeing here. If you do a back of the envelope calculation for adults to reach 70%, looks like we need about 18 million to go. And right now we're vaccinating about 1.1 million. So we could get there. But as you pointed out, the vaccination rate has been slowing down. And so that's why it's vitally important that we redouble our efforts and try to keep those numbers and our rates up.
And Dr. Bell, the CDC is advising anyone with a history of multi-system inflammatory syndrome to delay getting a coronavirus vaccine. Can you explain why?
Well, I think this is a concern based on how MISC works. This is what's called a multi-system inflammatory syndrome. So it's actually your immune system responding to SARS-CoV-2, but it actually goes a little out of control to the point where the immune system can hurt you. Similarly, the job of the coronavirus vaccine is to also induce an immune response. And so there is that concern that maybe you could kind of tip it into overdrive again and cause more problems, at least acutely, if you get vaccinated early on after the course of MISC. The other thing we know is that there's no particular urgency for patients who have had MISC or children because they do tend to have high antibody levels, which means that they should have good protection. So that idea of waiting 90 days and maybe giving a chance for the immune system to cool down a little bit, for lack of better words, and then getting vaccinated, understanding that you do have some protection that period makes a lot of sense. So we can take a breath and look at studies further. The CDC did note that there's no specific data linking a risk of getting vaccinated with children with MISC, but it's something that's worth looking into.
Well, hundreds of American colleges and universities are requiring students to get vaccinated before the new school year. But this could pose a problem for international students, as some vaccines overseas are not approved here in the U.S. Would international students have to be revaccinated, and is that even safe?
I think that's a question because some of the colleges are requiring students to be vaccinated regardless of where they come from. And so when you have a policy like this, you have to think about what are those structural barriers. In addition to different vaccines available in other countries, there are some students in countries that don't have good access to vaccine at all. And so what do you do about students like this? I think you craft a solution where you can have students come to the U.S., have vaccine available to them, and then have them able to serve a quarantine period until they can go back into the classroom. So you can have a system in place to make sure that students get access to vaccine, whether it's overseas or if it's here in stateside.
Well, the White House says it will donate nearly 19 million vaccine doses through COVAX, an international vaccine sharing program. They will be given to Asia, Africa, and Latin America. How important is it for the U.S. to lend a hand globally? And do you believe the administration is doing enough?
It's incredibly important because we know that the global fight against coronavirus is also our fight. And while the U.S. has ready access to vaccines, a lot of parts of the world do not. And we also know that when the virus is able to circulate uncontrolled, that we have a situation where variants can occur. And there's concern. Luckily, we haven't seen anything like this so far, but there could be a variant down the road that could potentially escape the vaccine protection that we have now. And so it actually is in our best interest, both from being a good citizen, but also in our best health interest to make sure that areas that have low vaccine availability do have some. Several people in the public health community have called for this. I do think that we can also do more where we don't have an issue with vaccine supply here. So I think there's always more that we can do, especially if we're looking down the road and trying to catch up countries that don't have ready access right now.
All right, Dr. Tyson Bell, always good to have your expertise. Thank you very much.
Thank you.